Now we're going to community medication. Okay, so we done the hospital medication. Now we will be going to the community setting medication. Okay, so in the community setting, if they already said that already entered the house and from there you need to start, then accordingly always listen the examiner. If they are not saying anything, you just need to start with the knock knock. Okay, knock knock.
Hello.
Hi, I'm Bindu Matthew. The nurse came from the community and is this Joe's house?
Yes.
Okay. Is that okay? Can I enter the house?
Yeah.
Okay, that's fine. Is there any pets or anything?
No.
Okay. So I can see the scene safety. I'm entering the room. Joe, is that okay? Can I can I use this table for keeping my all articles?
Yes.
Okay, that's fine. Joe, as I said, I am the community nurse. My name is Bindu Matthew. So I'm here to give you some of the 12 o'clock medication. Is that all right?
Yeah.
Okay. So I'm just going to gel my hands, okay? Joe, before I go ahead, is that okay? Can I check your ID, please?
Sure.
Okay. Can you tell me your full name, please?
Joe Smith.
Okay. And can you tell me your date of birth, please?
23rd July 1972.
And can you tell me your full address?
72 Northampton NN2 7AL.
Oh, thank you. That's correct, and all my records are showing the correct address and the details. How can I call you?
Joe.
Oh, that's good, Joe. So how are you feeling?
Fine.
Okay, Joe. As I am doing the video, that's the reason I am focusing the camera. Always make sure you should focus to the patient only, okay? Okay, Joe. So before I go ahead, are you in any pain?
No.
Okay, that's good. Okay, and are you in any allergic to any medicine, food, latex, or plasters?
No.
Okay, that's great, Joe. So before I go ahead, so it will take, I'm going to prepare all the medication, so it will take 10 to 15 minutes. Are you okay for staying like that?
Yeah.
Okay, that's great. Are you comfortable there?
Yeah.
Okay, Joe, that's fine. So am I okay to use your sink for wash my hands?
Yes.
That's great, Joe. So I'm just preparing the medication now. So as soon as I'm done, I will come back to you. And if you need anything, you can call my name. My name is Bindu. Is that okay?
Yeah.
All right, then. Thank you. I'm just preparing all the medication now. So I'm going to do the. I'm going to prepare all the articles. So before that, I need to do the hand wash. As there is no sink here, I'm doing the handle instead of. Wrist. My hands are dry. So in community setting, you can expect the medication in a box or in a tray. They will be arranging for you. Okay. So I'm just going through from the front page itself. So Joe is reviewed by the community health nurse for poor nutrition at his residence, and administer and complete the documentation of their 12 o'clock medication. So I'm here to give the 12 o'clock medication. So Joe Smith, date of birth 23/7/1972, address is 72 Northampton N2 7AL. Doctor's name is Dr. A. Richard, surgery Northampton GP surgery. I can see that doctor's name and GMC number and signature is here. So I complete my details. Name, initial, signature, and community. For you, it might be OSCE they will be putting, so you just need to accordingly you just need to add that one. And Joe is not allergic to any medication. So I'm just checking all the credentials on the second page and third page is the same as Joe Smith on the first page. So all the paperwork are same for Joe Smith. So today, losartan 50 milligram per oral, 12 o'clock, time 12 o'clock and frequency OD. End days is plus 6 days and the prescriber name, date and signature is there. So losartan is for blood pressure. So losartan 50 milligram. So losartan 25 milligram. So I need and expiry 26/7/2026. So I need to take 2 tablets of that. And metformin 500 milligram per oral for 12 o'clock and that is for OD and end date is plus 6 date. Prescriber signature, bleep number, name are there. So prescription is clear, legible and valid. So I need to take metformin. So metformin dose 500 milligram, expiry 26/2026. So I need to take 1 tablet from there. So Joe had cocodamol 500 milligram, 30 by 50000 milligram per oral 10 a.m. So it's been taken by, it's been given by one of my colleague at 10 o'clock. So he's prescribed some paracetamol and ibuprofen for PRN medication for the pain. As far as he is not complaining of the pain, I'm not giving. Joe, I'm just verifying that I'm not in any pain, isn't it?
Yeah.
Okay, that's fine. So I'm not going to give any pain medication for him now. So I need to give losartan 50 milligrams. So I need to take 2 tablets of it. So losartan 25 milligram, expiry 26/7/2026. And I need to give metformin 500 milligram. So metformin 500 milligram, expiry 26/7/2026. I need to take 1 tablet of it. So I have taken all the medication. Doing the hand gel again. Okay, Joe, I'm back with all your medications. Gel my hands, okay? So before I go ahead, is that okay? Can I check your ID again?
Yeah.
Okay. Can you tell me your full name, please?
Joe Smith.
Okay. And can you tell me your date of birth, please?
23rd July 1972.
And can you tell me your address with the postcode as well, please?
72 Northampton NN2 7AL.
That's brilliant. So you are my right patient. So I checked all the verification now. So Joe, it's 2 medications. It's a losartan and the metformin. Losartan for your blood pressure and the metformin for your diabetic. And I can see that you are taking that for a while. Have you got any questions about that?
No.
Okay, that's fine. Are you okay to take that medication?
Yes.
So do you want to sit upright?
Yeah.
Okay, that's fine. That's good. Do you want to take all together?
Yeah.
Or one by one?
All together.
Okay, that's fine. Good. Okay. So do you want to take some water with that?
Yeah.
Okay, can you take this water first?
Mm-hmm.
Okay. And can you take that medication?
Yeah.
Okay. Is it all gone through?
Yeah.
Can you open your mouth, please? Okay, that's great. I can see that it's all gone through. So that's fine. So I'm just gel my hands again. So I need to only put the signature. So signature, date and time I completed on the losartan, and I completed the signature on the metformin as well. So there is only 2 medication I'm supposed to give. Okay, Joe, I have given all your medication now. So as I said, because it's a blood pressure and for the sugar medicine, so make sure you should have your food regularly, okay? And if I will be wait for another 30 minutes here, if there is any kind of reaction or if you feel any giddiness or anything like that, please let me know. I will be here only. So once I left from here, if you're feeling like something, if it is any kind of reaction, you can call our GP center, or if you feel that it's a extreme emergency, you can call the 999. Is that all right?
Yeah.
All right, Joe. Thank you. While I'm here, if you need anything, please shout my name. Okay. So I'm just going to get rid of all my equipments, and I'm tidying up the medicine trolley, medicine cupboard, and I'm going to wash my hands. Is that okay?
Yeah.
All right, okay. So I'm just going to discard all the medication, discard everything, and I'm going to wash my hands. Okay. So so there will be slight differences in the community setting and the hospital setting. So hope you are clear about everything. Thank you.